Hey, good day everybody. Dr. Randy Wurtz in Thrive Chiropractic. Thanks for joining me today. Hey, I'm going to talk about crawling for babies today. Now, crawling is very crucial, but it reminds me of a story. Actually, a little guy that I seen in my office back in Green Springs. This little child couldn't walk, and actually was going on about 14 weeks and had him in therapy. Was not walking. Was not actually kind of like scooted on the knee a little bit, tucked his knee underneath his body and was crawling with his hands and the other leg, but could not walk and could not even walk. Now, definitely a child needs to walk by the age of 16 months. 14 months is definitely pushing it, okay? Around the age of 1 is when the child should walk, but they should actually crawl around the age of 7 to 9. So this is what is important about crawling is actually brain development. Actually, you're using your body, and then baby's using their body to program their brain at that time. So, hey, the left side will affect the right side of the body, and the right side will affect the left side of the body. So if you're using your right hand and your right leg, you're actually using both sides of the brain. Incidentally, this is where reading starts, because you're learning how the left brain controls what the definitions of the words are. The right brain controls the story, so comprehension. So if those are working together, hey, your baby's already starting to program their body and their brain so they can adapt to reading at such a young age. This is the case with me. I was always in the slow reading group when I was a kid and just really couldn't comprehend a lot of things. And turns out my mom says, hey, Randy, you really never crawled. You went from kneeling to kind of walking. You skipped that step. And when I started getting more active, reading became easier for me and school became easier for me. Still struggle with reading from time to time because of the comprehension. Go back and read it a couple times. So crawling is very important. So some things to encourage crawling is obviously tummy time. Tummy time is important because it brings the child's head off, and it's the beginning stages of when they start to learn posture. And it's when this curves in the spine start to develop, the forward curve and the backwards curve and the mid back and the revert and the forward curve and the low back. It starts with them having tummy time. That's why it's so important too. Now, you can encourage them to crawl. I mean, you have to challenge them a little bit. You know, the toys that they really like, just put them out of reach a little bit. Make them crawl for it. They got to start learning that they can see other, that can actually start to do that. Now, if you have them with other children, awesome. That's even a bonus because they see the other kids crawl and they do it. Definitely wouldn't encourage them every time they grunt or go, don't give them the toy. You know, have them come and get the toy. They might get a little frustrated, but you know, that's how they will learn to crawl a little bit quicker too. Now, give them a safe place to explore too. It might be a living room. Set some pillows up for the sharp edges, or even in the grass if it's nice time. If it's nice outside, give them a safe place to explore, to try, even put pillows up, you know, have them crawl over the pillows. Sometimes it's a matter of, I can't really get up on my knees, so you might have to put your hand right back behind their feet so they can have something to push off of and get going, and that's a good way to get them started to crawl as well. But by all means, if you see a baby scooting on their butt, you know, I think it's cute, and you see diaper commercials that they're scooting on their butt, but look at their faces, they're very frowned. This is not normal, okay? They're not using that opposite hand and opposite foot, and they're using that to get around, and that's not cool. That's not really good for their bodies and their brain development. So each stage plays a part. You know, oftentimes what I'll see is misalignments in the hips that aren't allowing the hips to move correctly, or it hurts when they move their hips. These problems can be from birth, you know, maybe a tight diaper, or even like hip dysplasia. So make sure we're checking that out as well. And if there is some questions where you feel like, hey, the baby's not crawling as well, by all means, if they're not crawling by the age of 9 months, get them checked up. Definitely get the baby checked up. Make sure there's no issues with hip dysplasia. They'll do an ultrasound for that. But if that's all clear, hey, we got to ask the question, what's wrong with the hips? And that's where doctors of chiropractics who specialize in kids are very good at finding those issues with the babies that aren't crawling. I'll put a link in this as well. The ICPA, International Chiropractic Pediatric Association, has some good ways to find pediatric chiropractors that would definitely help with your child as well. want you to have a wonderful day. If you have any questions, please give us a call. I'd be happy to help you in any way possible, and I want you to have a blessed day as well. Take care. Bye.